I'm here with Karen here, and what we're going to do is a retreat root canal. She's having problems with a root canal that was done before. And I'm going to start with a consent form. She needs to consent to the procedure. A retreat root canal is not as successful as a regular root canal. So she needs to know that going in. I'm going to tap on the tooth to see if it's still sensitive. And it is. This tooth has been sensitive for about a month, and I tried a course of antibiotics and it didn't work. Sometimes that helps, so we're going to retreat that root canal. Put a little topical anesthetic on there first. I'm going to give her an injection of articaine 4%. I'm going to isolate the tooth with a rubber barrier called a rubber dam. She has a crown on that tooth. We're not going to take the crown off. We're going to drill a hole through the crown so that I can access the root canal system. Stephanie here is suctioning for me, helping me out. So we're going to go ahead and make a small hole in the crown, which I'll repair later. Now the first thing I like to do when I try to do a retreat root canal is I like to see if there's any additional nerve canals inside the tooth that maybe were not treated the first time the root canal was done. If there is a missed canal, that's often the reason why the root canal fails. That's why the root canal doesn't work out. So I'm going to look for that first. Now retreat root canals are a very complicated procedure, and I'd recommend that a root canal specialist or a very experienced general dentist do this type of treatment. So we're going to go ahead and look for that if there is an extra canal in the tooth. I'm using magnification here, but microscope would also be appropriate here for those who have a operating microscope. And in fact, there is a fourth canal.